Hello, wonderful people. My name remains Dr. Madwako, and I'm here to continue our discourse on this channel of lastlongerng.com. Today is unique in the sense that we will be answering questions, and these queries have been posed by our clients, our esteemed clients. Your question may be here, your question may not be here, but the essence of putting together these questions and answering them in a video is so that you could learn from another man's mistakes, or you could learn from another man's solution and begin to implement it exactly the way it's working for the other person. I'm open to queries. You could send me an email, drmadrako@lastlongerng.com, or if you're in the UK, you could call me up on plus or 07341322683. But if you're in Nigeria, you could chat up with me on plus 447-341-322-683, and I'll be there to discuss with you and provide solutions to you. So right away, we dive into the crux of the matter. I've asked my secretary to put up this and compile all the questions the clients have been putting through, but we've decided to cover up the area of privacy so that you are able to have that confidence in sending forth your questions, and we're able to answer it without revealing your identity. So straightforward. The first question is talking about being diabetic. He said he's diabetic and he experiences erectile dysfunction, and he has stopped taking alcohol. And I'm sure he stopped taking alcohol because he is diabetic. Probably he's been advised by his physician, his clinician, to stop taking alcohol because alcohol will exacerbate his diabetes. In this question, I want to draw an analogy between diabetes, the erectile dysfunction, and alcohol. Diabetes, it's not very good friends with alcohol because alcohol constitutes its own processed sugars. But that's not the main crux of our discussion or our discourse today. What we're trying to rule out, or what we're trying to talk about, is that if someone is diabetic, he already has a prejudice to his erectile function, because diabetes, hypertension, high cholesterol levels, these things block up the vessels that lead to erection. So before we talk about these blocking of the vessels that lead to erection, we need to understand what erection is all about. For you to have a hard erection, it means that you have good blood flow, good engorgement of blood vessels in your penis or your manhood. And if you are erect, you could notice that the blood vessels are bigger, they are engorged because blood has flown in and you've had some vessels that are engorged, the valves are closed up, and you have erection. So when you have diabetes, when you have hypertension, when you have high cholesterol levels, these are chronic diseases that compromise the vessels. So when they compromise the vessels, you have problems with erection. So if he is diabetic and he experiences erectile dysfunction, number one rule to make sure he comes back to his function as a man is to control the diabetes. How do you control the diabetes? There are lots and lots of ways of controlling diabetes. We know about drug therapy, we know about exercise, we know about food intake. Now that's a different kettle of fish, but as a highlight, for you to control the diabetes, you need to engage, you need to see your dietitian, you need to engage in proper diets, you need to engage in exercise. You could get the home workouts, is on our website. You need to engage in proper exercise, as well as you're taking your medications. And your medications could be insulin, sometimes it could be oral hypoglycemic agents, which you take. But diabetes needs to be controlled. When diabetes is controlled, that is when you are on the pathway to experiencing erectile function that is back and optimal. So first step, control diabetes. And I've talked about the means to control diabetes. Second step, start exercising the penis. How do you start exercising the penis? The penis exercises, the penis workouts, which you can do in the comfort of your home after you've done home workouts. Home workouts is to help you increase blood flow all over the body, including the penis, it is equally to help you control your blood sugar. It is equally to help you control your diabetes. And it still helps you in erectile dysfunction, because when you have home workouts, when you do 10 minutes of home workouts in the morning, you're increasing blood flow to all parts of the body, including the penis. You're equally increasing blood flow to the muscles that will help you burn off cholesterol faster. So you have less cholesterol to be stalking the vessels, leading to erectile dysfunction. So for him, it's good he stopped taking alcohol because he is diabetic. So control diabetes. For him, he controls diabetes, goes on the home workouts, goes to the dietitian and has a diet plan. We'll soon be rolling out the diet plans on our website. Second thing is to begin to exercise the penis. And once he does this, he's going to have his blood sugar come down. He's going to have erectile functions start coming back. Now, that is where you can talk about using the Vigo caps or using the V-Swiss or using the Viagrax. All these are for helping you jumpstart the process when everything is on ground. If you are diabetic that is not controlled, you take alcohol on top of the diabetes, making the diabetes not to be controlled, and you take Vigo cap or V-Swiss or Viagrax or whatever you want to take. Yes, we have some of these on our website. Yes, we distribute some of these in Nigeria. But the truth is, you must have these things controlled before these agents will help you jumpstart the process. And that is why most people are on the usual, I think it's Viagra. Most people are on Viagra, Vigo cap for life. Those are not meant for you to be on it for life because the background hasn't been settled. You need to settle the background first before you take these things, or while you are settling the background, while you are doing the home workouts, while you are controlling your blood sugar via using the dietitian's diet plan, you are taking these drugs. They are jump-starting the process for you, and that helps you in the long run because you don't now need to continue on it after you've taken your 4 packs for Vigo cap, or you've taken 2 packs for Viagrax, or 1 pack for V-Swiss. So it's all knowing when to take it and how to take it, and most people just take these things while doing the things they are doing wrong. Now I've addressed the first question. The second question said he's having weak erection despite doing body workout. That's cool. And penis exercises. Now you could see that it is the opposite of the other one. Now you ask yourself, why is he having weak erection even though he's doing the things that should increase blood flow to the penis? That helps us to look for other causes of weak erection. Is he masturbating? Does he have high blood pressure? Does he have high blood sugar? Does he have high cholesterol levels? These things need to be checked out before we are able to reach a diagnosis to say this is exactly what is wrong and this is why he's not having a very good erection. Now, at this stage where we don't have the information about whether he's masturbating, whether he has high blood pressure, whether he has high blood sugar, I'm going to give a generalistic solution to this, which means for him at this stage, if he's masturbating, he needs to stop it. If he's having problems stopping it, there are links. I'm going to be dropping links at the bottom of this video, which will take you to the part of the website that talks about how to stop masturbation. And you can go there, you can follow the rules there, follow what we tell you, and you stop masturbation. Now, why do you not need to stop masturbation? Because masturbation will always weaken the penis. Masturbation will always lead to premature ejaculation, number one. And if you are older, you're going to be having erectile dysfunction. So if it's hypertensive, that needs to be controlled. It's just the same way we control diabetes. You need to control that. You need to do the workout. You need to do penis exercises. You need to take the Vigo cap or the Viagrax or the V-Swiss to have any effect. Now, since we don't have information about those other things, that's why I've given the generalistic opinion. Let's assume that he is not hypertensive, which means he doesn't have high blood pressure, he doesn't have high blood sugar, and he doesn't masturbate. He's doing his body workouts, he's doing the penis exercises, and he's still having an issue with weak erection. In that case, we investigate him for high cholesterol levels. How do we investigate him for high cholesterol levels? He goes to a lab without eating in the morning ask for a fasting lipid profile. Ask for a fasting lipid profile, send in the results to my email. I will review it, and I will tell you whether your cholesterol is high or not. Let's assume that his cholesterol is normal. So he has normal cholesterol. He is not hypertensive. He is not diabetic. He has no problems. He's doing his body workouts. He's doing his penis exercises, and he's still having weak erection. The next question would be, is this weak erection with every partner? It could be psychological in terms of the weak erection. It could still be coming from an untreated sexually transmitted infection. And that is where we need to dig deeper to find out exactly what could be wrong. If he had had an untreated sexually transmitted infection, yes, this weak erection would not just be alone. It will usually come with a deficiency of sperm count or deficiency of semen. Or sometimes people use the colloquial language, watery sperm. So for this, we need to find out a lot of information. So if you are listening to me and you're the one that sent in this, I would ask you to send in some collateral history. Tell me about yourself, about these things I've mentioned, and we'll be able to guide you appropriately. Now, this other man talks about body massages with lubricants. He wants to increase his penis size. I can't get this very well, but what I think he's trying to say is that he massages the penis with lubricants and he wants to increase his penis size. This is a no-no if you want to increase your penis size. This is a no-no if you want to run away from premature ejaculation and ultimately run away from masturbation, because if you are using lubricants to do body massage or try to increase the penis, you are going to end up masturbating, especially when you're coming from a background of masturbation. So we know that if you want to increase your penis size, you have to do penis exercises. You can't take the VigoCap or the Vigras. Vigras is very good, especially for penis size increase. And when you are doing the penis exercises, you don't use a lubricant. You use tight-fitting penis pumps or penis tools to help you, and you do it 10 minutes in the morning. If you have a partner, in the open glare of a partner, that removes the capability of turning it into a masturbating episode. So that answers that question. The next question I want to answer is asking permanent cure to quick erection apart from sprays. The permanent cure to quick erection apart from sprays is, number one, sprays are not meant for permanent cure. So if you understand that, so you don't put sprays as one of the options. We have the stored spray, which is on our website, but it is not meant for a permanent cure to quick ejaculation or quick, I think he's talking about quick ejaculation, not quick erection, because quick erection is a good thing. He's talking about quick ejaculation. So quick ejaculation most times has its roots in masturbation. Permanent cure to quick ejaculation is stop masturbation. When you stop masturbation and you start exercising the penis, and you can use the VigoCaps to jumpstart the process, you don't need to be perpetually on the sprays. You can use the sprays while you're using the VigoCaps to jumpstart the process, but you don't need to. You use 10 sprays every time you're using sprays. You don't need to be perpetually on sprays because you want to avoid premature ejaculation. Most times the roots is on high cholesterol levels, lack of exercise, lack of penis exercise, and most especially masturbation. I come to the next question. He talks about he is hypertensive and experiences quick ejaculation, and his dick is shrinking in size. Exactly what I mentioned in the first question about diabetes. So if you are hypertensive and you are not controlling that very well, this is what you're going to be experiencing. And this is going to be coming with mostly erectile dysfunction before quick ejaculation. And your penis or manhood shrinking in size is expected, especially if that hypertension is not controlled and you are not increasing the size of your penis actively through penis exercises, through using the VigoCaps or the Vigras, which is very, very good for penis length increase. So It's very important that you control your blood pressure. How do you control your blood pressure? Exercises, home workouts, very important. Take your drugs, very important. As well as exercise that part of the body which most people don't exercise, which is the penis. And once you do that, you'll be able, it's a win-win situation. Your blood pressure is controlled, your penis is increased in size, and is ready to go, and erectile dysfunction is nowhere to be found. Now, this is very important. He is currently on Zeloda, experiencing premature ejaculation and losing his erection gradually. For people who don't know, Zeloda is a chemotherapeutic agent. What I'm talking about, it's used for persons who unfortunately have a malignant ailment. You don't need to know about that, but for the purposes of other persons who may have it, I'll put it in black and white. It's for persons who have cancers, and Zeluda is a drug used for cancers. And I know you may be watching me presently, and it's an unfortunate situation, but it usually comes